Right. I think in between I can just admit them while you start presentation.
Yeah, I think we can just start and people are gonna keep joining.
All right. Okay. Because we have already record. All right. Assalamualaikum and very good evening and the afternoon. Very good afternoon, Dr. Pablo Perez. Okay.
Morning, morning,
Right.
yeah.
On behalf of our organization team, I'd like to welcome to all of you on the special collaborative teaching section on construction site and safety management. We are honored to host a series of insightful lecture from distinguished international expert in the field of construction safety and management. So today, feature three esteemed speakers actually. Okay, we who will share their expertise on health and safety, learning from design success and failure, and designing for safety in constructions. Without further ado, let us begin. All right. So it's my pleasure to introduce Dr. Pablo Perez. Is it correct?
Yes, yeah,
Okay.
that's perfect.
All right. A respected academic from UWE Bristol, whose work focus on operational health and safety management system and risk governance. In today's session, Dr. Perez will be discussing strategies and best practice for managing health and safety within organization. Please join me in welcome Dr. Pablo Perez. Okay.
Thank you very much, Elma, for the introduction and evening to everyone. Selma said it's good morning here. So I'm now in England. So today I'm here to talk about health and safety management in organizations. It's going to be the main topic for today. But before we get into the topic, I'm sure you want to hear a bit more about me. My name is Pablo, as Elma said. Um, I I work at UE, Bristol, University of the West of England, in Bristol, very nice city in England. And I am currently a senior lecturer in construction project management. So I'm a chartered construction manager, and I also lead with one of my colleagues, I lead the undergraduate construction project management degree at UE. My background, I am a civil engineer as my BSc by my background, but then I started going to the route of construction project management. So I'm more into people, communication, delivering projects instead of more the calculation number side of construction. But then I got so much interested in health and safety during that transition that I decided to do my PhD on health and safety. So my PhD was focused specifically on what we're going to be talking about today, which is management of health and safety in organizations. I've even before I joined academia, I have some site and project management experience. I used to try and control projects back in the Dominican Republic, where I'm from, and also worked in some research projects on energy efficiency in buildings. That's a very old picture when I was much younger. So okay, so what do we have today? Before we talk about managing health and safety in organizations, I wanted to set a bit of a background first on health and safety, and how the construction industry performs, mainly in the UK, but I'm certain that the same performance is reflected in other countries around the world. And then we will see how we introduce the role of management into health and safety, and then focusing more on health and safety management systems. In the end, I'm gonna talk a little bit about the CDM regulations, the Construction Design and Management Regulations 2015, and in the UK, and how they play an important role in the management of health and safety in construction. So let's make a start. Health and safety, it's a very widely known term, and we always refer to it as health and safety. So we get health and safety in construction left, right, and center. But how many of you have actually reflected on the fact that there are two very distinct words in this expression or in this term? So The two words we have is health and safety. So we're actually referring to two different things when we talk about health and safety. I need something not everybody is aware of it, or if it's aware, sometimes we forget. The health. Health is the protection of bodies and minds of people from illness resulting from either materials, processes, or procedures used in the workplace. So it's more looking into health and illness of people. Whereas safety, which is probably what we're more familiar with, is the freedom from risk of injury from any unplanned event in a working environment. So this one is more about the protecting people from physical injury. So that's the difference there. One thing is illness, so maybe just the internal of the body, and the other one safety, which is more physical injury. For example, if you break a leg. Health, let's say if you get cancer, God forbid, from any sort of dust breathing on construction sites. So from now on, we're going to keep referring to the term health and safety, but please be aware that we're trying to refer to both health and safety, because health usually is the one that is usually left out. So why do we talk so much about health and safety in construction? Why is it so important, at least from the management point of view? First things first, we as individuals, we need to be looking after ourselves, okay? So we don't want to be breaking our legs, we don't want to be hitting our heads, we don't want to die, do we? So it is an individual responsibility to take care of ourselves. However, under the UK law, employers also have the duty to look after their employees, but not only their employees, but also members of public. If some people are walking around your construction site, employers have that duty to look after, after those people too. So there are different imperatives on why we looked into health and safety. There's the moral reason, there's the legal reason, and then we have the economic reason. We're going to quickly define these three just to understand what we refer to. First and more important one is the moral imperative. What this one means is that health and safety, making sure that everyone stays alive, is the most important thing to do. We need to look after people. We don't want people to die. So we need to protect people. We need to make sure that they go home, probably, hopefully, even healthier than how they got into our site in the morning. So it is the right thing to do. Is that you need to have that feeling that I need to do the right thing for myself and other people. But unfortunately, that's not always the case. Sometimes we have people that don't care about others, and that's why we have regulations. For some reason, human beings, or at least some human beings, like to be told what to do. They don't want to do what's right, or what they don't know what is right, unless we have a piece of paper or laws that tell you that you need to do it that way. And that's the legal framework. In the UK, for example, we have the Health and Safety at Work Act that was enacted in 1974 that outlines, it is the main piece of legislation, in managing health and safety in the UK. Of course, this is an act, it's an enabling act. So there's a lot of other regulations that feed into this act. For example, the CDM regulations. If you're breaching the CDM regulations, you're automatically breaching the Health and Safety at Work Act. And as a consequence of the legal framework, or if you're breaching any of the regulations, oh yes, I forgot. When we have one thing is having the regulations, but then we need government or authorities to help enforce these regulations, right? In the UK, we have the Health and Safety Executive. The Health and Safety Executive was created when the Health and Safety at Work Act was enacted. So the act gave power to this authority to enforce the legal framework of health and safety in the UK. In Great Britain mainly, because it's a bit different in Northern Ireland. So the Health and Safety Executive, I like calling it the Health and Safety Police, but it's probably the wrong term because they just not only prosecute if someone breaches any health and safety law, they also help and collaborate with local authorities just to make sure that they try to prevent death, injury, and ill health in Great Britain. So to do this, they carry out inspections. As I said, they prosecute whoever breaches any law, but they also spend a lot of resources assisting and preparing publications, training and information, guidance on how to best manage health and safety. They also propose regulations. And an interesting part is that most of their funding come from fee for interventions. What this means is that if they go to your site and everything is fine, you don't need to pay them. If they come to your site and they do see that some things are not as they're supposed to be, they might spend more time in your site, in your organization, and then that's when you're going to receive a bill that you need to pay them, which is by the hour. So yeah, that's the Health and Safety Executive. We're going to keep making some reference to them because it is that main authority that we have in the country. As an effect then from the legal procedures, then comes the economic reason. We have fines. If you're found liable and you're convicted for health and safety offenses, you're going to have a fine. In the UK, these fines can be unlimited because they've done it in a way that whatever fine they give you is going to hurt your business. So it's going to really depend on your company turnover, how serious the negligence was, and also how serious was the impact of that accident. Let's say if someone died and you are a multi-million pounds company and you seriously were found to be negligent in the management of health and safety, you're going to have millions of pounds of fines to the point that you can even go to bankruptcy. There's also compensation payments. If your employees might take you to court for some compensation, but there are also indirect costs that probably we don't think directly on that they're going to have an impact in my organization. For example, the reputation. Will you hire a construction company that you know that have killed people or that someone has died working for them? That could have a serious impact on how you start winning jobs. And lastly, imprisonment. You can go to prison. If they found that you didn't do what you're supposed to do, of course, you can go to prison up to 2 years, I think. I think it's on one of the slides. Okay, so now we understand what health and safety is and why we manage it. But where does it sit when we're managing a project? So you might be familiar with this triangle because it's a very widely known, the widely known project management iron triangle, which is time, cost, and quality. We deliver projects considering these three main constraints. The interesting part of these constraints is that they can be trade-offs. You could have priorities on some of these and more than in the others. For example, if you're building an Olympic park for some Olympic Games, what is your priority? You have a date of when the Olympic Games are going to start. So time is not really that flexible, but you might have I don't want to say unlimited money because money is always important, but the cost of it is a bit more flexible. So you will focus more on time and quality. Whereas in some other projects, time might not be an issue, and you can focus more, or your priority goes more into cost and quality. But the question is, what about health and safety then? Is that something we can trade off in a project? So whenever we present this, we like saying that health and safety sits in the middle here, just because of the fact that it's not something, it's not a trade-off. It's not something you can play around in terms of its priority. Having said this, health and safety is the core of management. But what are the odds that something wrong is going to happen to me? You know, whenever we're doing something, what are really the probabilities? You might say this is not going to happen to me, but that's the moment where it is going to happen to you, because things can really go wrong. Even if you've worked in this doing the same thing for 40 years and nothing has happened to me or happened to you, it can go wrong if you're not doing the right thing. To the point that it can even lead to death, unfortunately, and it is probably the worst outcome we want to have on our construction site. Either because you can die, but also your workers, employees, or people around your site could die, and that could bring very serious consequences. Personally, of course, it's going to affect you personally, but also from the business side of things. Sorry. So how well do we do in construction? The best way of assessing this is looking at statistics. Starting in the UK, at its peak, we have about 2 million people that work in construction. And every year we have an average of between 45 now these days fatalities in a year. If we look at an average of the last 5 years. But last year we had 51. So it's been increasing in the last few years. So definitely says that something is not quite right there. So 51 people that have lost their lives working in construction. I also had a look on how it is in Malaysia. And according to DOSH, it is about 45 fatal injuries from January to October 23. And I highlighted here in red that that's the ones reported to DOSH only. So how many, probably not only in Malaysia, but in a lot of other countries, how many fatalities do we actually have that are not reported? So statistics sometimes can be tricky in that sense. But regardless of whether the statistics are accurate or not, in the UK, for example, we have 51 too many fatalities. And in this case, Malaysia, we have 45 too many, because how many deaths is acceptable? Hopefully, I'm hoping that you're all saying zero. Sorry, we need to target 0 fatalities. Until this number hits 0, then that means we still have a lot to look into. And I wanted to quickly show this graph to show that the UK has 51 fatalities a year, and we are one of the safest countries in Europe in terms of health and safety. Looking at this graph, this is the fatal injuries per 100,000 employees. And even though it's a bit from 2016, it's still relevant. It's about 0.5. But even being one of the best, we still have too many fatalities. And why? Why so many accidents? Why do we have so many accidents in construction? Yes, it is one of the most dangerous industries when we compare it to other industries. But why is this? First of all, it is the way construction works. We need to accept that our construction projects are unique. One day you're building a skyscraper in the middle of a city, and the other day you're building a swimming pool in a villa next to a beach. So completely different projects, that they lack standardization. You're going to be working with completely different grounds, completely different technologies, with different clients that want different things. So construction has that particularity that every project is unique. So management health and safety then is going to be particularly unique for each of those specific projects. That's one of the first things. The second thing is that construction is fragmented in the way that there is a life cycle to deliver a project. We have a lot of different professionals that get together or try to get together as a team to deliver a project. So we have design, construction, and operation. These are, let's say, that the main key stages of a project. Then whatever happens in design, how is that transmitted or delivered, communicated to construction? And then from construction to maintenance. Is there an actual thread there of coordination to make sure that it is managed well? That's why you'll see on another session later today, design for safety. How from that design stage, you will have to start considering health and safety measures to make sure that in that construction and operation of the building is done safely. That's the second one. Another one is that we build up. Usually we build up. When we talk about skyscraper buildings, even if it's 2-3 stories, we're still working above ground. So someone needs to go there and work on those temporary platforms. And what could happen? Then people can fall. But we also work below ground when we have when we work on basements, for example, or we're doing excavations, and there's the risk there is high when we collapse risk when we're working below ground. So that's also another problem. We also work in the external environment. So we're prone to any changes in the weather. Wind is one of those things to look for, but also rain. It really depends on where you live in the world. You might have earthquakes. So there's a lot of factors there to consider. Difficulties of supervision, which that one is very clear. The one I want to touch on more is the emphasis on cost. In construction, we like money too much. So of course, it is a business. We want to try and make a lot of money from it, but not to the point where we compromise health and safety. And that's the line that we sometimes cross. Lastly, the quality of the workforce and training. In the UK, particularly, we're having an issue with the workforce, that we have an aging workforce, so we don't have the next generation coming into the workforce. So the impact of that is that we have untrained workforce, or we're trying to find anyone to do the job. And of course, if someone is not trained, he's not going to do it safely. So that's another issue there. And how is it that these people are dying? When I say that there's 51 fatalities in a year, how is it that they're dying? More than half of those are falling from height. Falling from height is the biggest killer in construction, not only in the UK, because I actually checked the data from Malaysia, and they say that over 40% of the people that die in Malaysian construction is falling from heights. It's because one of the things that I mentioned here, we work above ground, so and we are exposed to and prone to falling from height. Does that mean that is accepted? No. It's how can we manage that? Other reasons here or other causes is trapped by something collapsing, struck by moving vehicles, or electrical discharge. But the main one here that we need to remember is falling from height. But it's okay, isn't it? Accidents can happen. In fact, when we look at the definition of accidents, it is something that is unexpected. So the HSC is aware of this, and as human beings, we always not always, sorry, we're prone to make errors. We make mistakes. It doesn't matter how well trained or motivated you are. You might be making any errors at some point. Yeah. In fact, some of the major accidents or catastrophes around the world across different industries throughout history has been caused, or after some, of course, investigation, have been caused by human errors. For example, this Piper Alpha was an oil rig that caught fire in the middle of the sea, and 167 people died. Chernobyl, which probably we're all familiar with, was caused by human error. So now let's focus a bit on that human error. Even though accidents can happen, most of it is caused by human error. Something that they were not supposed to do. Okay. And in fact, in construction sites, 90% of those accidents are caused by human error. The question is, are we going to start now blaming that worker, that employee, because they just made a mistake? Remember, everyone can make errors, no matter how well trained and motivated they are. So why are these accidents happen? This 90% of accidents, is it because carelessness? Is it because they were not paying attention? Is it because they were incompetent? Are we trying to find one excuse just to blame those workers, and us as managers just try to clean our names? So I think this is the moment to introduce the 5 whys tool. So the 5 whys tool was developed by Sakichi Toyoda, which in fact is the founder of Toyota. He was an inventor and a very when it's about quality, he is one of those most important people to look into. So when we try to understand why accidents happen and we look into accident causation, we should be looking into the root cause analysis, which is trying to understand what is the root of that accident. Why did it happen? So Toyota's 5 whys tool is quite simple. It's nothing out of this world. It's not rocket science. Basically, you start with a statement or an accident. This happened. And you need to ask yourself or ask around at least 5 times why. Why did this happen? You have an answer. Why then this happen again? Until at least 5 times, or until you get to that root cause of that accident. That's I've put that little GIF there of kids. That's why kids are so curious, are all the time just asking why. We should be doing the same. We're trying to question things and trying to get to that root so we can learn from it. But I'm sure that if you start asking those questions at least 5 times, the whys, you will see that it can be attributed to organizational failings. Okay, so even if it's an individual error, a human error, this is something predictable because we know that human error can happen. So it can be identified and managed throughout risk assessments, maybe. But going back to the 5 whys, you will see that most of it, if not all of them, are attributed to something wrong in your organization. Something failed in your organization, even if it was human error. So that's why now I'm starting to introduce a bit more the concept of the role of management into health and safety. So the performance of organizations in terms of health and safety is strongly linked on how well you implement a safety management system. Okay, let's repeat that one. The performance on construction organizations in terms of health and safety is strongly linked on how well you're implementing a management system. We're going to define what a management system is in a bit. So what is it that can go wrong in terms of management? There's a lot of different factors. The HSC, for example, focuses on these ones. It could be that you didn't plan your work very well, and now you're late. Then you have the time pressure, and because of that, then you forget about health and safety, or it's not your priority anymore. But maybe you didn't have any safety systems. It could be that you didn't learn from your mistakes, that something went wrong and it kept going wrong and wrong without responding to those incidents. Pure communication. Communication is key in managing health and safety. So if there's no communication, that's attributed to management on the way you have communicated the management of health and safety. It could be deficient coordination and responsibilities, which is more about who are the ones responsible for managing health and safety. An overall poor management of health and safety, and one very important one is our health and safety culture. We need to have a good safety culture, health and safety culture within our organizations. Why? When we're supervising a construction site, we as construction managers, we have a lot of things to look into. We can't spend, let's say, 10 hours in a day just watching how someone is doing something to make sure that they're doing safely. We need to trust them. But for us to trust them, we need to have that health and safety culture embedded into organizations that you know that that person can be trusted in terms of safety. And that's why when something goes wrong on a construction site, one of the first things to look into is how was this managed? Could this have been prevented? Don't worry, we're not going to read through this. This is section 2 from the Health and Safety at Work Act that I mentioned earlier. Just want to highlight what is in red there, that in every part says, so far as is reasonably practicable. So let's read number 1. It shall be the duty of every employer to ensure, so far as is reasonably practicable, the health, safety, and welfare at work of all his employees. So it says that employers need to make sure that their employees are safe, but it clearly says so far as is reasonably practicable. So what does that mean? We commonly call this SFRP. So when we're doing our risk assessments, how much should we do to try and manage that risk? That's where the so far as is reasonably practical comes in place. It is a bit of a tongue twister, so sorry. So, for example, would you spend £1 million to prevent 5 staff from suffering bruised knees in a site? That sounds a bit disproportionate, no? But would you spend that same £1 million to avoid an explosion that is going to kill 150 people? Well, we would be expecting that you would be spending that £1 million. It's very silly examples, but it's just to show you that what this proportion would mean when we're managing risks. So when something goes wrong, this is what we need to make sure that we are doing. That we're doing so far as it's reasonably practicable, that we make sure that we have done something about it, because as I said, accidents can happen. So going back to my MagicM management slide, I call it MagicM because management is the solution on how for health and safety performance. So I said earlier that safety performance in construction organization is strongly linked to the effectiveness of implementing a management system. So When we are sorry. When we look at the different aspects of health and safety at an operational level within a business, either you're on site or providing resources, monitoring it, planning, health and safety training, your company policy on health and safety, it all needs to be tied into a health and safety management system. Because if not, how will you know when you're on site what needs to be done? How would you know what you need to supervise? How would you know how to assess the risks? So there needs to be a system within the organization that is going to outline what is it that needs to be done. And that's what that management system is. So a management system is a planned, documented, and verifiable method of managing hazards and associated risks. So we need to plan how to do it, document it, then, of course, execute it. And it can be verified, so you have the evidence that it is there to be considered. Since workplace accidents can have a detrimental impact into organizations, more into their operations, it is indeed a major concern for our organizations. If something goes wrong on your site, in the UK, in England, they're going to stop your site for nobody knows how long. They're going to close your site. So while they're carrying out investigations, which means that you're not going to be progressing, developing the project, but also means that your company might be found liable and might be convicted. So it's definitely something to look into. So what the HSC has done, the Health and Safety Executive, as I mentioned earlier, also provides a lot of guidance on how to manage health and safety. So to make things simple, they published the HSG 65, which is a guidance on how we implement management systems. Just to be clear, the management systems in the UK is not a legal, it's not something that you have to do legally, okay? It's voluntary. However, it is a very good system, as I said here, to have a plan, documented, and verifiable method. So when that accident happens, if it happens, you have the evidence that you have done so far as is reasonably practicable. Okay. So the HSC has provided that guidance. What is it that I need to do then? How do I implement a management system? What even is this? So this document has advice on those core elements of how you manage health and safety, deciding what is it that you're doing and how you're going to do it. And it also provides resources that if you are not aware of how to do it, the health and safety executive, if you look at their website, you will find a unlimited series of resources depending on what you need guidance on. So we're going to have a quick look into what it looks like, what is a management system, and how do you prepare one. The health and safety executive one, this one, the HG 65, is based on a plan, do, check, act cycle. You probably might have heard this before because the PDCA cycle comes also from manufacturing, and it's also implemented across other different industries. So it's as simple as it sounds, really. So plan, we need to plan what we need to do. Do, we need to execute what we plan. Check, we need to monitor how well we're doing it. And act, if something needs changing, how are we going to do it? Or we need to make any changes. And then we start again over that cycle. So what is the plan? What do we plan? Basically, having a clear implementation plan. We identify the risks that we might be facing, try to predict what are those accidents that might happen in our business or in our project. Because I mean, if you think about construction, the potential risks that you can have in construction, they can be unlimited. So you need to think a bit more in your scenario, in your organization, what are those type of risks that you have to evaluate. But also, you need to have a well-defined organizational structure within your business. Who is responsible for what? Do you have a health and safety officer or a health and safety manager that is the one that is going to make sure that this system is working and is in place? That needs to be ideally written down, of someone is assigned to that role. In the UK, we need to develop a health and safety policy. The health and safety policy, the business writes down their statement of intent, which is to explain how they are committed to managing health and safety in their business. This also will set out the names and positions and the roles of those one in charge of managing health and safety. So this is one of the few legal requirements in terms of the management system. If you have 5 or more employees, so you must have a written down policy in your business. So it's not just an indication of good practice and just have one piece of paper. It needs to be something meaningful and comprehensive that anyone can actually read. Then, we have a plan, but are we actually implementing it? It's one thing is saying and one thing is doing. There's a big difference there. So how are we implementing that plan? So in this case, we make sure that we deliver the plan. And this is where we carry out risk assessments. We deliver what we said that we were going to do on those risk assessments on how we're going to manage those risks. In the UK, we have a regulation, which is the Management of Health and Safety at Work regulation from 1999, which is the one that sets out that we need to carry out risk assessments. So under the law, risk assessments are mandatory. But then we need to check how well are we doing it. You can be doing the same thing wrong all over again. So we need to monitor and measure that performance. We compare what we planned against what we're actually doing. And how well are we reporting this? We have the reader, which is another regulation in the UK about reporting accidents, fatalities, of course, dangerous occurrences, and illnesses. So under the law, we have to report these work-related injuries and ill health, but also near misses. There's a list. If you look at the regulation, you will see that there is a list of what they consider as near misses that need to be reported. But if something is not reportable on the reader, does that mean that I shouldn't investigate it? No. We used to have an accidents book where anything that goes wrong or a near miss, you write it down, not just to have a record of it, but to try and understand why this happened and how to be proactive and how we can do something about it so it doesn't happen again. So what things can we actually measure? This is when we need to outline or define those KPIs. How are we measuring our health and safety performance? It could be the number of reported accidents and incidents. It could be the lost time of workers because of being unable to be on the site, equipment breakdown, overtime hours, satisfaction of people, of the workers. So it's really up to you or to your business how you want to measure, what you want to measure. But just remember that you can't manage what you can't measure. If we don't measure that performance, then there's no way to improve it or to at least understand how well we're doing it. Finally, is act. We review our performance, we checked, but then is there anything that needs changing? Have we learned anything on how we can improve it? So this is the stage where we make those changes and then we start over again into our cycle. So, I mean, in these 15 minutes, I think probably, or 10 minutes that I've been going through the system, just shows you a very brief overview of what it is. Of course, it's a lot more complex than this, but it doesn't have to be that complicated. This guide from the HSC was published because in the UK there's a lot of SMEs, small and medium enterprises. In fact, about 99% of businesses in the UK are small businesses. So they wouldn't, if it's too complex and complicated, they wouldn't be able to actually implement this. So they've put it in plain English just to try and make sure that everyone, regardless of how big your organization is, can implement a management system. If you want to go step further, there's ISO, the ISO standards, which you might be familiar with. They have the 45001. The ISO 45001 is the occupational health and safety. This one replaced the ISO 18000, the OSHA's is 18001. And you can actually get this certification from ISO that you implement a health and safety management system. There's also an ILO OSH 2001. It's probably over 20 years old, but is still relevant and provides very similar structure of what a management system is. So what I've done here is to show you a bit of a mapping of all the different options that you can have for implementing a health and safety management systems. I mean, we can see that they're all based on the same PDCA principle. Regardless of the wording, they might have an extra stage, but they can be mapped to a plan, do, check, act cycle. And that's why the health and safety executive one, the HSG 65, has just simplified it into a more plan, do, check, act, which in fact is very similar to the ISO 45001, which is planning, support, performance evaluation, and improvement, more like synonyms. So what are the benefits then of implementing a management system? One key one is that it's easier to demonstrate legal compliance. How do we know that you're doing what you're supposed to do? How do we know that you're managing health and safety to the best practice? So implementing the management system is going to take you to that series of steps of what needs to be done. And as I say here, it also demonstrates that so far as it's reasonably practicable, the S4P that we discussed earlier, that you're doing the best you can to make sure that you can manage those risks. And of course, because you avoid accidents or trying to prevent accidents, you reduce the cost associated to these accidents and incidents. Hopefully you're not going to prison. You can integrate these systems with other systems, such as quality systems. It shows your genuine commitment to health and safety. It shows that you actually care about managing health and safety. And to the point that it can even boost your reputation and attract business. If you get ISO certified, for example, other companies, other clients are going to trust your business because they can see that ISO has certified that you have a good system in place. It's the same with quality and the environment. When we see an ISO certification, we tend to trust those companies more. But is it that easy to be implemented? No, not really. More when we look into small businesses because of the nature of construction. As I said, time is gold in construction, so there's always the pressure of time. But there's also not that much awareness of these management systems and how to implement them, which is why I'm here to talk about this today. There could be also lack of interest of either employees but also workers. If there's no leadership and motivation, there's then no way that this can be implemented effectively. So we need to be aware of what these barriers can be, so we make sure that we tackle this and we can implement them effectively. So another issue then, let's say you do have a management system in your organization, but considering that the industry is fragmented, as I said, in the UK, 99% of companies are small contractors. So the way it works when you're delivering a project, you have a main contractor, but that main contractor is going to hire a subcontractor, and that subcontractor is going to hire another subcontractor. So it's very fragmented. How then do you make sure that it all goes together and they adopt your safety culture? So that's where leadership and that safety culture comes into place. And as I promised, I wanted to explain how then the construction design and management regulations come into place. Just because this fragmentation, we have the regulation that enables this collaboration between the different duty holders. So between client, designers, and contractors, including subcontractors, they all need to be looking after each other. So if the contractor is doing something wrong, in this case, the client and the designers are also liable for it, because they need to make sure that the contractor is doing what they're supposed to do. And it is what I find is the quite interesting part of the CDM regulation, that it enables collaboration between the different roles. This is just a quick example of a case scenario that happened here in the UK. We're not going to get too much into detail about this. I'm conscious of time here. So basically, we have a client, which in this case is Taylor Grange Developments. They hired Allied Contracts to act as the principal contractor to do some demolitions and and to build some rental units and flats into a site. But Allied Contracts also appointed someone else to carry out the demolition. So we have the client, we have the principal contractor, but also we have another contractor. And this guy, Richard O'Hagan, actually had an accident. Fortunately, he didn't die, but he fractured his neck, back, and ankle. So guess what? All three of them were taken to court, and all three of them were convicted under the CDM regulations, just because that last contractor had an accident. So even the client was fine, principal contractor was fine, and the contractor was fine. So the goal here, or what we should be targeting here, is that zero accident vision. How can we have that as a culture in our organization? Is that even possible to have zero accidents? So is health and safety, is good health and safety an unreachable utopia? That means is it just a dream that things can be delivered safely, that people are not going to die, that we're going to have zero fatalities in our industry, in construction? That's a question that hopefully you can take from today. And as a reflection of that question, there's a case study that I would recommend you to look into, which is the London 2012 Summer Olympics. So as you can imagine, the magnitude of an Olympics project, in 2012, the UK delivered this project with safety records. The record was that there was not a single fatality in the delivery of the project. In fact, they were expecting 4 people to die. You might be wondering, oh, am I expecting people to die on a site? Does that mean that if 4 people die, it's okay? No, this is based on statistics. Based on statistics, the people that die and the people that work on a site, you can kind of predict how many fatalities you might have. But in this case, there were 0 and it was a record for Olympics projects, even though they employed 12,000 staff and involved 80 million man hours. So it is possible to have zero fatalities. How did they do it? There is an interesting white paper that was done on this, just having a look into how the project was managed to make sure that the health and safety was looked into. But this is summarized by this YouTube video. Alistair Gibb is very, very well-known academic on health and safety. It's a very interesting 18-minute video. He did a TED Talk on how health and safety could be managed at that Olympic level. So in conclusion, construction, we know that is dangerous. We're still going to need construction probably for forever. But it should be managed from an organizational and an operational level, because that's what gets translated through the site level and how subcontractors, contractors are managing health and safety. So the core, that root, is the organization. And a way of doing this is implementing a management system. How well are you implementing and establishing a management system? And how well structured it is. And to be able to implement it after you have structured it, you need competence and leadership, because that's what's going to promote that health and safety culture that it's so important in managing safety, health and safety. So thank you everyone for listening. I hope that this was useful and you have learned something from today. I've put my email there, so if you have any questions after today, feel free to get in touch or get in touch with Lina or Elma, and I'm sure they're gonna pass the message. So thank you everyone. If you have any questions, more than happy to take them now too.
Okay, thank you, Dr. Pablo, for the excellent presentation. We now move on to the Q&A session. Then maybe we can take one or two questions. Anyone?
Hello.
Yes, please.
Hi, I'm Irma. Sorry, I just now I heard about the CDM regulations. I just want to clarify because we need to appoint designers principal and also the contractor principal, right? So meaning that the designer principal is from which trade, from which background? Meaning that is it from architect or from the CNS or from the MNE? And what kind of the certification required to appoint this principal? Thank you.
Hello, hi Irma. Thanks for your question. It's a very interesting one, because I know Malaysia is now implementing the similar CDM regulations. So it's about establishing who the duty holders are. In this case, you have the client, contractor, designers, principal contractor, and principal designer. So the client has the duty to appoint them in writing. So who's going to be the principal designer? It really depends on the project. It doesn't necessarily have to be an architect. It depends on what role they are assuming in the project. So it could be an architect, it could be building surveyor. It depends on who is managing that design stage of the project, who is going to oversee the other designers. So for that, you need to look at what are the key duties of that principal designer, to make sure that whoever is taking the role of the principal designer can actually deliver those duties. I hope that answered the question.
Yeah, thank you.
Another one question, maybe? Anyone?
Looks like everything was clear.
Okay. Maybe I take one question, Dr. Pablo.
Yeah.
Because in project management iron triangle, we have time, cost, and quality, right? So how can safety culture can be effectively instilled in an organization with limited resources?
That's the problem, isn't it? That we're always
we
going
can
to be,
minimize because there's
yeah, we always are going to have that constraint of time, because as I say, we never have all the time in the world to deliver a project, because every day costs money. But also we have very limited financial resources, because the margins in construction, they're not that high anyway. So the key, or what we try to promote, is that health and safety priority needs to come from even the inception of that project, from that client point of view. The client, they have the duty to make, under the CDM regulations, that they need to provide all the resources needed to manage health and safety. So the client needs to have that mentality that whatever is needed, whatever is the cost of that will be, has to be done. So it's not that the contractor will have to carry all that burden of the cost and the limitation. That needs to be communicated throughout the different duty holders, stakeholders, and make sure that that's the ideal scenario, that we all agree on that, and we all playing our part. But in reality, yes, it is difficult, and it is why collaboration. That's why, at least in the UK, we're focusing a lot more on collaboration in construction, talking more to designers, implementing BIM, to make sure that we can all collaborate in that environment and be on the same page.
Okay. Okay, thank you, Dr. Pablo. I think
Never cut corners. Never cut corners, Alma. Yeah.
all right. Okay, I think if you have another question, maybe you can email Dr. Pablo, because we have a constraint in time. Okay. As we come to the end of this evening's special collaborative teaching session on construction site and safety management, I would like to extend my deepest appreciation to our distinguished speaker, Dr. Pablo Perez, for inspiring lecture. Thank you very much. Okay, class, we have another session with Professor Patrick Maino at 8 o'clock. So please join early, okay? Maybe at 7:40, right? 7:50, can?
Yeah, hello. Elma, please, is it possible to take a screenshot photo?
Sure.
Yeah, so we can, document this. Okay, for
Sure. Can
Pablo. Yeah,
open your cam, please, at this. Oh, yeah, so Professor Patrick Manu here also. All right. Yeah, I will take the picture. Okay, count 3, 2, 1.
There he is. Patrick is there.
All right. Okay, wait. I post before, because we have another slide. Oh, okay. We have 3 pages.
Thank you very much, Elma. Thanks
Right,
everyone
okay, thank
for joining.
All right. Okay, thank you, Dr. Pablo. Okay, we have another session at 8 o'clock, right? Okay. See you.
yeah.
Bye.
Thanks very much.
Bye.
Yeah.
All right.
Thank you, doctor.
Okay, thank you.
Thank you, doctor. Thank you, doctor.
Thank you, doctor. Please
Doctor.
join
Thank you,
again.
doctor.
Please join again. All right, thanks.
All right, doctor.
Okay.
Thank you, everyone. Bye.